we have a look about low back pain in this video. The most commonest type of workout injury is lower back pain. Low back pain can result from a strain of the muscles surrounding the spine due to overuse, bulging or severely damages spinal discs, or a macrotraumatic injury to the disc. Spinal fractures from weightlifting are uncommon, but not unheard of, including a chronic form of stress fracture called spondylosis, as well as an acute compression fracture of one of the vertebral bodies. There are some risk factors that can predispose the lower back pain. A few of the risk factors for back injuries include position of the back during a weightlifting exercise, such as the amount the lifter can engage the entire core to support the back, pre-existing back issues, and daily habits unrelated to the gym are also risk factors. For example, jobs with prolonged sitting as well as jobs with heavy lifting can both pose risks to the lumbar spine. During a lift, if you're using too much weight and your back rounds, you might have injured your back. Severe, unrelenting pain, inability to move the muscles of the legs, and trouble controlling bowel bladder function are indicators of an injury. Pain running down the back of the thigh toward the lower leg often indicates irritation of the sciatic nerve, but could also be caused by a muscle spasm in the low back or gluteus. Here these are the recommendations for treating back injuries. The inflammation phase of all musculoskeletal injuries is 5 to 7 days, and during this time we suggest avoiding Romanian deadlifts, overhead squats, weighted squats, and all twisting motions. The repair phase starts up to 7 after the injury and can last up to 2 months. Romanian deadlifts with light weight are okay during this phase, but avoid good mornings and Olympic lifts such as the hang power clean. The remodeling phase can last anywhere from 2 to 4 months to a year, and we recommend adding the good morning exercise and slowly increasing weight with squats and integrating Olympic movements. Lifting with a well-positioned, neutral posture spine goes a long way to minimize the risks of low back injury. So better you can follow these recommendations and continue your workouts in a healthy way. Thank you so much for watching this video.